Basically, at Will Vision, we're pure refractive surgery. If someone has a medical problem, we're going to refer you to a specialist in that area. So our principal procedure that we do is LASIK, but LASIK is kind of a generic term. It doesn't really encompass, the nuances of modern technology. And so it's hard to communicate to patients because what do you call it if it's not LASIK? Over the years, we've tried different things. Eye LASIK is kind of the new name that we've applied to it. Well, what in the world is eye LASIK? Basically, eye LASIK works off the principle that we use a very sophisticated aberrometer to measure the eye. That gives us the ability to measure the eye 25 times more accurately or more precisely than glasses. When you go to the eye doctor, they ask you which is better, lens 1 or 2. That's kind of old school. We're now 25 times more precise than that. In addition, we used to kind of think about eyes as coming in, shapes like a billiard ball or a football. Well, that's not really true. Eyes are kind of misshapen, kind of more like a football with the air let out on one side, and so it's kind of a contorted shape in terms of how we want to address it. So we have to customize our treatment, and so that technology, that aberrometer, that eye design system allows us to measure all those nuances and variabilities in the way the eye sees, and allows us to create an algorithm or treatment protocol that delivers exactly that pattern to the eye. What does that matter? It allows us to provide better vision than people can get with glasses and contact lenses. Better quality daytime vision, better quality nighttime vision. In fact, the sensor that's in the eye design is designed and built by the same engineers that built the aberrometer for the Hubble telescope. Remember the Hubble, it was a disaster when it went up to space. They sent up a team of astronauts to fix it. Well, guess what? They put an aberrometer into that system. The engineers that built that aberrometer built our first wavefront aberrometers here, and that same sensor that's now in the eye design is the sensor that's gone into the James Webb Deep Space Telescope. That's the one that NASA is launching this year, and it's going a long ways away. You're not sending anyone up to fix it, so it's got to work. So when we say that we've got technology that can measure the eye at an impressive level that's never been attained in human history, that's because we're using spin-off technology from NASA that obviously works. Anyone who's seen a photograph from the Hubble telescope knows that's amazing. Well, we can do the same thing with the human eye. So LASIK has evolved to the point where we're not just taking glasses away and replacing it with something that's similar. We're making eyes better, vision better, better quality of life, better nighttime vision than people have with their glasses or contact lenses. So that's really exciting. The second piece that we really haven't been able to fix very effectively over the years has been the whole problem with reading glasses. It used to be, well, okay, we'll do LASIK for your distance, but yeah, go down to Kmart and get yourself a pair of readers, and away you go. Not anymore. With the KAMRA Inlay, we can now fix people's near vision, and at the same time maintain their distance vision. Never before in the history of mankind has that been possible to do. So it's really exciting to be alive and well and working in 2018 because it gives us so much satisfaction to be able to deliver these kind of visual outcomes for patients, and the patients love it. It's just it's like they say it's a miracle, and it is a miracle. I mean, I'm looking at their eye and I think it's a miracle, and they just are blown away by the excitement and the results and the vision that they have. It's hard to put it into words.